Now we're going to talk about phosphorus and how is phosphorus regulated in our body and how do we take care of abnormal phosphorus levels in our bloodstream. So let's talk about phosphorus and how it is managed in your body. And first of all, we have 85% of our phosphorus is within our bone and bone structure. The other place that it's secondly commonly found is in our cells. We have 14% of our phosphorus is found inside of our cells. And then the 1% that's left is what we find in our extracellular, and that's what influences our bloodstream and our bloodstream amounts. So our normal range for phosphorus is our 2.5 to 4.5 approximately. And again, it is low in that because of the low amount that's available to be in our bloodstream. But that's what we have to regulate and keep phosphorus at. So how do we keep phosphorus elevated or keep this levels? Well, we do eat food that has phosphorus in it. Lots of phosphorus. Lots of foods have phosphorus in it. How else do we regulate it? We can regulate it via our calcium. Again, it's the opposite. It's inversely. So it's the inverse with calcium and phosphorus. So as we regulate calcium, as we talked about before with our parathyroid and balances with calcitonin, when that gets changed, it also changes our phosphorus levels. And then we also need to think about the kidneys. Kidneys have a little bit of regulation in that we can excrete certain amounts of phosphorus as needed as well with our patients. Now, why do we need phosphorus? What's the purpose in this 1%? And also kind of feeds into cellular is that if you remember correctly about our energy source for our body is ATP. The P stands for phosphorus, adenine triphosphate. And so the thing that I remember with phosphate is that it is helpful for the energy levels in your body. And the three areas that phosphorus energy is important for is in your food metabolism. So it helps with metabolism of protein, fats, carbohydrates. It helps also with muscles and nerves. So muscles and nerves need that energy. And so when you have problems with phosphorus, you'll see changes with that. And then the last thing it does help is with your RBCs formation and health of your levels of RBCs, and also with the regulation of RBCs with the oxygen level. So that has a lot to do with energy. So the problems we see in our patients have to do with the levels of ATP or energy. Now let's talk about phosphorus and what may cause you to have an imbalance in your phosphorus levels. So let's first talk about hypophosphatemia and what may cause that. First off, since the majority of our food has phosphorus in it, if you were to decrease your phosphorus intake in malnutrition, that can cause you to have low phosphorus in your bloodstream. Another way is to make it leave the GI tract abnormally, and alcoholics have a tendency to lose phosphorus out of their GI tract before it can be absorbed. Also, the overuse of antacids. There are certain antacids that are binding to phosphorus, and that can also make it leave the GI tract before it's absorbed. Another way for you to have low phosphorus is to hide it within your cells, because they can handle a certain amount. There's a certain amount of phosphorus in your cells. And one of the ways that that can can be done is alkalosis. So having an alkalotic situation may also sequester it in there. And then the other way is your kidneys. Your kidneys have a certain amount they also lose over time, which is a part of the regulation. But if you have too much loss with diuretics, you can have a problem with having too low phosphorus in your bloodstream. Or if you have a patient that has a hyperglycemic condition where they have an increase in their glucose in their bloodstream, it spills over to the kidneys and pulls water, and it can pull phosphorus out as well. So either way, it can be lost via the kidneys too quickly and lower it in your bloodstream. So those are the possible ways to have too low of phosphorus in your bloodstream. Now let's look at the ways that you could have possibly increase of phosphorus in your bloodstream. And let's go back to the kidneys and look at that. And if you have kidney failure, you will definitely be holding on to your phosphorus and not losing it. And that's a very common problem with our patients that have renal failure, is that their phosphorus levels get too high in them. Another way is to get phosphorus out of our cells. And an acidosis condition will pull that out. So will sepsis. And then the third way is if we have destruction of our cells. If you destroy cells, that releases that phosphorus out into the bloodstream, and that would be with patients who have trauma to their cells and cell breakdown. And so these are ways that we can elevate that. And then the last way that phosphorus can be brought up is to have a imbalance, disruption of your calcium levels. And so we tend to see when calcium gets out of balance, for example, with hyperthyroidism or with hypoparathyroidism. So even though these may raise calcium levels, that's a disruption and it will throw the phosphorus off, and it will also elevate in the patient's bloodstream. And why do we worry about phosphorus? As you remember, ATP is where phosphorus does its work in the body, and it works on various cells and components of functioning in our body. So we're going to see changes in our patients when we have phosphorus changes. We're talking about problems with our central nervous system. We're going to have problems with our heart being able to beat correctly. We're going to have problems with our GI tract. We're going to have problems with our muscles in general. We're going to have problems with our red blood cells and them not being able to release the oxygen, which is important as the other component to make ATP in our processes. And again, our nerves kind of also need that process going. So all of these will become weakened when we have problems with our phosphorus levels. So how do we treat patients that have too high or too low of phosphorus? Let's talk about having too low of phosphorus. And most of the time it's because of malnutrition. So let's work on increasing our food intake. If we can get that person out of malnutrition, that will help. We can also give supplements. We can give oral supplements of either sodium or potassium phosphate. So we can give that orally. We can also give this in an IV of sodium or potassium phosphate. And it's very important that we give it in TPN if a patient is getting total parenteral nutrition. Phosphorus definitely needs to be a part of the electrolytes. In fact, all electrolytes need to be included at certain amounts within TPN, but very important that phosphorus is, because we need that phosphorus for the energy levels that a patient needs for all the healing processes they have. So that's how to increase phosphorus when we have patients with lack of it. Now let's talk about if we have too high of phosphorus. Well, the important thing about that is we've got to fix what caused it in the first place. So if we have a problem with our calcium balance and what's causing it, we have to fix that. If we have a patient that has it because of kidney failure, the fix for that, if we can fix a failure, that's great, but sometimes we can't. They have to go to dialysis. So kidney dialysis may be the treatment for a patient that has kidney failure, and that's part of the processes to remove off excessive amounts of phosphorus. And then another way via our kidneys is to work on flushing it out. So we can flush it out. And we can use diuretics, but we also, if we use some normal saline IV, that IV can help to flush it out. And we can increase fluids orally or IV. Again, we talked about doing an IV. We can have them drink more. And so by doing those kinds of things, we can help bring down phosphorus levels that have gotten dangerously high.